Friends, welcome to Happy Nursing. This is Ila and we were discussing the developmental stages in our previous videos. Today we will discuss a new phase of development briefly, the development through conception. What are the small changes during pregnancy? What are the risk factors and can pose a threat to the unborn? And what are the fields where the would-be mother needs education? Okay, so let's see. Intrauterine life or the interval between conception and birth is divided into three parts: first trimester, second trimester and third trimester. It lasts from 38 to 42 weeks of gestational age or after starting of the pregnancy. First trimester is the first 3 months after conception. By 12th week of pregnancy, that is towards the end of this period, the fetus has all its body parts, weighs approximately 3 ounces and is almost 3 inches long. There are some factors in the first trimester we need to be careful about. These are called teratogens. Teratogens come from the Greek word tera, which means monster. It is an agent or factor which causes malformation of an embryo. For example, nutrition, stress, infectious disease, drugs, environmental factors, incompatible blood types, maternal age and paternal factors. Women should be educated to avoid teratogenic factors as much as possible and make healthy lifestyle choices. Diet of a woman in this period is a very important factor to look after. If a woman does not consume adequate nutrients and calories during pregnancy, she may not be able to meet the nutritional requirements of the fetus. For women who are at normal weight for height, the recommended weight gain is 25 to 35 pounds and an intake of 1800 calories per day is needed. Next crucial factor is stress. Women going through different stressful situations like marital problems, broken relationship, loss or death of a family member, etc. throughout pregnancy are more likely to give birth prematurely. Some general and unavoidable stressors are also there. For example, most of the women in first trimester suffer from ambivalence, that is mixed feelings, contradictory ideas about pregnancy, fear of added responsibilities, doubt regarding added role of mother, unpreparedness, etc. These feelings generally resolve by the beginning of second trimester. Infections such as cytomegalovirus, rubella, varicella zoster, herpes simplex, hepatitis B and human immunodeficiency virus during pregnancy can affect the health of the mother, the fetus or both. Most of them cross the placental barrier resulting in severe birth defects, premature labor or even fetal death. Other infections such as genital herpes can cause injury during the birth itself. Many of the drugs can cause prenatal damage. Women should be counseled not to use any of the over-the-counter medications or herbal supplements without consulting the doctor at this time. Alcohol should also be entirely eliminated throughout this period and post-pregnancy period also. Radiation, chemicals and environmental pollutants such as carbon monoxide, mercury and lead are also harmful to the developing fetus. Pregnant mothers should avoid these things. Use of saunas and hot tubs are harmful during this period. They raise the mother's body temperature which interferes with cell division, resulting in possibility of birth defects. Incompatibility in the mother's and father's Rh factor also poses risk to the fetus. Suppose an Rh positive man is married to an Rh negative woman and they have an Rh positive baby. Now individuals who are Rh positive have Rh antigen on their red blood cells and those who are Rh negative don't have any antigen on their RBCs. So if an Rh negative baby is born, no problem. But if an Rh positive baby is born, he will have Rh antigens on his RBCs, right? So what happens? Whenever maternal exposure to fetal blood occurs, that is during pregnancy or during labor, the mother's blood comes in contact with the antigens present in the baby and recognizes it as a foreign substance. As a result, antibodies are produced which destroys the fetal RBCs. This exposure usually does not cause problems during the first pregnancy because most of the antibodies are formed after birth. But in future pregnancies, if again the Rh negative mother gives birth to Rh positive baby, then his red blood cells may be destroyed by the mother's antibodies because now they are already present in the mother's system from the first pregnancy period. So this mother should be treated with immune globulin to ensure the health of the fetus. What does the immune globulin do? It destroys the Rh antigens in the baby's blood which is exposed to the mother's system, keeping the baby safe before the mother's system gets sensitized. Maternal age is also a risk factor. Older women are at risk of giving birth to babies with chromosomal defects. There are some paternal factors also, like exposure to radiation, lead, pesticides, etc., which cause abnormalities in sperm resulting in birth defects. Smoking by the father can result in low birth weight of the baby. Next comes the second trimester, the time period from 3rd to 6th month. By the end of the second trimester, most organ systems are complete and have functional ability. Thus, the fetus is considered as viable and can live outside the uterus with intensive environmental support. The fetus is now about 11 to 14 inches long and weighs almost 1.5 pounds. The fetal heart rate can be heard through stethoscope, and the mother also becomes aware of the fetal movement. Several changes in maternal behavior can be seen during this period. The mother plans for the preparations of birth, becomes concerned for personal safety, and often cultivates preoccupied thoughts about her appearance and health. Education should be provided to the mother regarding gestational events, need for appropriate rest and physical activity, nutrition, infant feeding options, etc. Mother should be educated to recognize potential complications and preterm labor and report accordingly. Some of the risk factors which can cause premature labor are renal and cardiovascular disease, diabetes mellitus, uterine abnormalities, obesity, etc. History of previous preterm labor can also increase the risk. Research shows that mothers who are smokers or drug users, live in poor conditions and receive poor prenatal care also are at risk of preterm labor. Next comes the last 3 months of intrauterine life, the 3rd trimester. The fetus grows approximately to 50 cm in length and weighs about 3.2 to 3.4 kg. Brain growth also starts. Mother generally remains engrossed with the thoughts of the delivery and breastfeeding. Often they seek this information from the healthcare providers or family members. Mother should be educated about the need for an exclusive institutional delivery during this time. In some Western countries, birth setting choices are offered. Like those who don't want to give birth in hospitals can go through the process in their home or freestanding birthing centers with certified midwives present. An advantage of this process is that the entire family can be present with the mother. But in our country, institutional delivery is a must. So that's all for today. We have discussed the physical changes, risk factors and fields where mothers need to be educated during pregnancy. If you like this video, then please like and share this video and subscribe my channel. Thank you for watching.